When is a joint replacement necessary? Believe it or not, our joints are designed to move us through our entire life with ease. However, unfortunately for some, years of wear and tear, injury, or chronic inflammation can lead to joint degeneration that significantly limits their mobility and quality of life. And so one of the most common questions that people face when dealing with persistent joint pain is, will I need a joint replacement? So let's explore when joint replacement becomes a necessary option and what steps can be taken before reaching that point. So it's important to first understand joint degeneration. Joints are when two bones meet, cushioned by cartilage, and it's surrounded by ligaments, tendons, and fluids that all work together to absorb impact and shock, and it helps allow for movement. So over time, especially weight-bearing joints like the hips and the knees, the cartilage in between can wear down, and so as the joint health declines, many people would experience stiffness, inflammation, reduced range of motion, and pain, which then can impact day-to-day life. So this is often due to conditions like osteoarthritis. Now, most people don't jump straight to surgery, and so they shouldn't. Many people actually manage the joint pain for years and years with non-surgical approaches first, such as chiropractic care, doing strength and stability exercises, taking anti-inflammatories and supplements, using braces and getting injections. And these approaches, they aim to restore better joint motion, reduces the stress on the surrounding tissues, and it supports the body's natural healing capacity, and therefore it decreases pain. However, when function can no longer be maintained through conservative strategies, that's when joint replacement may be discussed and considered as an option. So some signs for when you would be a candidate for joint replacement surgery and where it would be recommended for you is when conservative care approaches such as chiropractic care, it no longer provides you relief. The pain persists even when you're resting or during your sleep. You've lost significant mobility. And you're losing independence in your day-to-day life. It's being significantly disrupted. But in saying that, it's important to also note that these decisions are never based on your imaging alone, because your lived experience matters much, much more than what actually shows up on a scan. So if you'd like to discuss this further, consider speaking to a chiropractor like myself or others at Pro Health, where we look at your whole body, look at your posture, your movement patterns, your nervous system, and your lifestyle habits, put it all together and see how your body functions. And so with the right support, many people are surprised by how much progress they can make. And so for me personally, my goal is to help people stay active, independent, and in control of their health. So whether that means avoiding surgery completely altogether, delaying surgery for as long as possible, or even preparing the body to recover well if it becomes necessary down the line to later then have surgery. So if you've been wondering whether your joint pain is something you have to live with or if a replacement is your only option, I'd love to chat with you to explore what's possible. So for an appointment, please call 6299 2660.